I've gotten a lot of emails from folks say, hey, I'm going to turn 65 soon, but I still have my job. I have health care through my employer. Do I have to sign up for Medicare when I turn 65? And I know there's this issue between small companies and large companies. Can you just help walk us through that?
Rule of 20. If you or your spouse work for an employer with 20 or more employees, then you have an exception to delay starting Medicare. Then you can delay Medicare. If you work for a small employer, meaning 19 or fewer, or your spouse does, if you're self-employed, if you're an independent contractor, if you're on the Affordable Care Act, Obamacare, if you're on COBRA, you have to sign up for Medicare by way of turning 65. Very important. It's one of the biggest mistakes we help people avoid. Because if you don't sign up timely, then you may be subject to a lifetime late enrollment penalty on both Medicare Part B and Medicare Part D.
Part D for drugs. Okay. And the Part D penalty is, I think, is 1% a month after you're off prescription. What is it? A creditable drug plan for so many days?
Yeah, and again, so much of this is learning the lingo. Creditable means at least as good as what you would have received from your employer provided coverage. And your employer is required to tell you, or your spouse's employer, as to whether their employer plan is at least as good as what you would receive from Medicare Part D. And they're required to keep that notice on file for 10 years.
Okay, good to know. And then Part B, that it's when you don't have Part B for a full 12 months, right? You get, is it a 10% penalty?
Yeah, 10% per year for every 12 months you don't have it. So my mom didn't have it for 28 months, and as a result has a 20% lifetime penalty on her part.
Yeah, and it's lifetime. It never goes away. Okay.